The Healthcare Federation of Nigeria Annual Conference, a pivotal gathering aimed at addressing pressing challenges within Nigeria's healthcare sector. Distinguished stakeholders from Nigeria's private healthcare sphere converged, bringing their wealth of knowledge to the table to tackle pertinent issues head-on. Dr. Pamela Ajayi, the president of HFN, emphasized that this was not merely an event, but a collaborative journey towards a healthier and more resilient Nigeria. Themed Bridging the Gaps in Healthcare, Public-Private Integration as a Catalyst for Sustainable Growth, the conference served as a beacon for positive change. Dr. Ajayi underscored the conference's significance as a platform where thought leaders, policymakers, and industry experts united to deliberate on critical healthcare issues in Nigeria.
Good morning, His Excellency, the Governor Somolu, represented here by the Honorable Commissioner of Health, our distinguished Chairman, Mrs. Bola Deshola, distinguished trustees, honorable members, commissioners of health. You are please permit me to stand on existing protocol. I would like to welcome everyone to this very important program, which, as we have, our co-chairs have actually discussed, is very key for our healthcare system. I'd like to take this opportunity of standing here to explain about the HFN and why our subject matter, our theme is what it is. The Healthcare Federation of Nigeria is the umbrella body for the private health sector in Nigeria. And our mission is to support the achievement of universal health coverage through private sector activation. And with the challenges that we experience in the country with our healthcare system issues to be resolved. So we are advocating for the fact that we want to move beyond public-private partnerships to public-private integration and creating a seamless healthcare system that works for the benefit of all. We have worked on this, and you will find when you see the program that we have major players from government. And it comes from a very personal place for me, a very important, and I'm extremely passionate about this. Because I would say that my journey is actually the journey of all of us. In setting up our organization, Pathcare Nigeria, I set up with the support of my wonderful husband, Richard, who is here. Can you give him a round of applause for me, please? We started off in 2003 and went through so much in terms of all the issues, and unfortunately, we're still experiencing them today. The issues of how to set up an organization, how to get things through, issues with bringing on equipment, issues with customs, issues with regulation, issues with taxes, issues. And one of the things that we need to do as a people is know that whatever has happened to us before, we need to make it better for people who are coming. You know, we have a huge challenge in terms of human resources. All of us are experiencing it. And we know that if we do not improve the system, we will continue to lose our young ones, because we need these young ones to stay, and we also need our diasporans to come back. So we need to fix the system, and we're hoping that together, public and private, sitting here in this room, we can work things through to create a better health system for all Nigerians. Thank you very much.
Good morning and welcome to the Healthcare Federation of Nigeria Annual Conference 2024. It is with great pleasure that I stand before you here as the chairman of the Federation. I've actually been a member of the Board of Trustees since inception 8 years ago, because I'm sure some people are wondering why would a banker be chairman of the Healthcare Federation of Nigeria? But I am a Nigerian. And just like everyone else here, I do care about the state of health in Nigeria and about making Nigeria a healthier nation. And I believe that in whichever way we can as individuals, we must contribute towards uplifting the health situation of Nigerians. So I welcome all guests here, participants and stakeholders. The Healthcare Federation of Nigeria, just as the president of the Exco said, serves as a beacon of unity and progress for private healthcare stakeholders across our nation. Rooted in our core pillars of advocacy, business growth, and facilitating access to healthcare financing, the HFN is committed to amplifying the collective voices of our members and driving positive change within Nigeria's healthcare sector. Central to our mission at the HFN is ensuring access to safe, high-quality healthcare for all Nigerians. This commitment goes beyond rhetoric. This conference serves as a platform for us to collectively chart a course towards achieving this shared goal. I would like to express my heartfelt gratitude to all our sponsors, and we can see the sponsor pages right across the room. In fact, up to yesterday, there were additional firms that wanted to sponsor this conference. So I really thank you all. I thank our partners and supporters whose unwavering commitment has made this conference possible. Your dedication to advancing healthcare in Nigeria is truly commendable, and we are honored to have you with us today. To our distinguished speakers, some of whom are already here, our panelists and the moderators, I extend my appreciation as you share your expertise and insights with us. Your contributions will undoubtedly enrich our discussions and inspire actionable strategies for positive change. Lastly, I would like to thank each and every one of you for your presence here. That is the delegates who have registered. We had, I think as of yesterday, about 300 people registered, and I think we have as many online as well. Your participation is a testament to your commitment to the advancement of healthcare in Nigeria, and I'm confident that together we will make significant strides towards a healthier and more prosperous future for us all. Once again, welcome to the HFN Annual Conference 2024. Let us embark on this journey together, united in our shared vision for a healthier Nigeria. Thank you, ladies and gentlemen.
Good morning and welcome everybody to Lagos. I bring special greetings from His Excellency Mr. Babajide Sanwo-Olu, the Governor of Lagos State, who unfortunately is on his way back from an international assignment, and he just couldn't make this meeting. He did, however, ask me to tell you that he's aware that due to his multiple assignments, he would have loved to be here because he's actually never been to one of these grand events, and that he hopes this time next year that it won't collide with his heavy schedule. Let me first of all, since protocol has been established, just thank Dr. Pamela Ajayi, the president of HFN, for once again putting together a very fantastic organization and an amazing program. I've been looking through the program. So what is the role of government and what is the role of private sector in achieving, as your thematic title depicts, bridging the gaps in healthcare, public-private partnerships or integration as a catalyst for sustainable growth? Now, it didn't say a catalyst for improving the health sector. And I think you chose your words very carefully in the HFN when you said, as a catalyst for sustainable growth. And I believe you mean sustainable growth of Lagos and Nigeria, economically. We all know how important healthcare is to the security of the nation. It was demonstrated clearly during the COVID pandemic, and how a single tiny little virus can bring economies to their knees in a flash. Economies around the world are still recovering from the COVID pandemic. Now, as a message from Mr. Governor, he has given us in the Ministry of Health certain mandates. And these are clearly outlined in the Lagos State Development Plan. It's a 30-year development plan. It has started since last year. It's to run to 2052. Inside that plan, it clearly states that in 30 years, Lagos is to achieve complete universal healthcare coverage and should be in the top 5 cities in Africa with the best healthcare systems and be one of the top centers for medical tourism. In other words, people should be coming into Lagos to receive both basic and sophisticated healthcare services. I believe already, and this is only the second year of this 30-year plan, that Lagos is already beginning to achieve that status by being voted the 8th best city in Africa for receiving healthcare. So accolades go to you as a private sector, and you can give yourself a round of applause. Because as I said, the ratio is 10 to 1. And every week we're beginning to commission very sophisticated private healthcare facilities in Lagos. Only yesterday, I was present at the commissioning of the first gerontology center in Nigeria and in West Africa, here in Lagos. A center specialized to deliver healthcare to the elderly. Geriatric medicine is a discipline in its own right. And for us to have such a center in Lagos is a demonstration already that we're beginning to provide a diversity of specialist healthcare to our citizens and to everyone in Lagos. So we're not living in the Stone Age here. Nigerians need to take advantage of what's happening. We have some of the brightest people on this planet. We have young people that are eager to make a difference. And so as government, it is our responsibility to create that enabling environment for Nigerians to prosper. And so on that note, I thank you really for coming to Lagos, for coming to listen to the very rich program that has been prepared for us, and coming to join forces and to not only conceptualize ideas, but define the strategy with which we're going to achieve sustainable growth in Lagos and Nigeria as a testament to what we can do as Nigerians for Nigeria. Thank you very much.
Honorable Ministers of State, Health Commissioners, invited dignitaries, and I'll stand on existing protocols. It's an honor to be here this morning. I bring you greetings from the President of the West African Private Healthcare Federation, Dr. Bogifu, who could not be here this morning. I would want to congratulate Healthcare Federation of Nigeria. I come from Ghana, and along with other federations, it's difficult to organize even regular monthly meetings, let alone an event like this. So it is a testament to Healthcare Federation's leadership in FOAPs, and it's an example to all other federations within the region. The role of the private sector, yes. The role of the private sector in supporting country ministries of health to solve critical public health care problems cannot be overemphasized. The private sector is agile, private sector dreams, private sector creates, private sector adapts, as we saw during COVID years. Private sector provides alternative employment as well as training and internships. And internships are very important in our sub-region. Governments provide infrastructure because Government have big budgets, huge budgets. Governments provide regulation and oversight, and governments provide an enabling environment for private sector to thrive.
Honestly, when Claire Omasai called me last 10 years that I have a vision, I want to bridge a gap in the healthcare system. I want to advance healthcare. I want to promote excellence. I said, you have me. Take all of me, and definitely I will join your association. And today, I'm so happy to stand here to tell you that HFN is a learning ground. When I saw they are thinking of policy, nothing but policy, how to assist the government, I used HFN as a platform to become the president of the Pharmaceutical Society of Nigeria. So I want to congratulate HFN for organizing this forum, and I want to pray to God on all what we discuss. Let it be productive, let it be successful, let it be at the end of the day lead to actionable outcomes. Actionable outcomes, not just talk. Actions. We have the two gurus here who will take it to the president. We will follow you to the conclusion to make sure all what we agree here are implemented. May God be with all of us. May God continue to strengthen the Healthcare Federation of Nigeria, to continue to give us a roadmap for the health and assistance and patient-centric, that at the end of the day, our patients will be happy that yes, we have done well. May God bless all of you pharmaceutically. Thank you very much.
Thank you very much. There you have it, royal and pharmaceutical blessings combined. Thank you from the other side.
The Minister of State for Health and Social Welfare, Dr. Alausa, expressed its unwavering support for the HFN movement. His presence at the conference solidified the commitment to effecting positive changes, fostering a collaborative effort between the public and private sectors to reshape Nigeria's healthcare.
I'm very honored to be invited to give the keynote address today at the HFN conference. I'm certain as a nation, we can bridge the gap in government and private sector integration for healthcare transformation. Nigeria has a unique healthcare system that is the primary, secondary, and tertiary level of healthcare system. Each level of government is likely autonomous politically and in terms of financing and managing health services under its responsibilities. Although it is one of the most fundamental human rights, this presents both economic as well as barriers to accessing quality medical services, resulting in poor health outcomes, inevitably trickling down to poor economic outcomes. A robust and integrated health sector with strong governance is essential in ensuring accessible, affordable, and quality health care. The goal of universal health coverage is to ensure that all people obtain the health services they need without suffering financial hardship when paying for them. While all countries in the world aspire to do this, their journey differs. One major factor that can accelerate or hinder success is how well resources are pooled, optimized to meet the needs of our people. It is becoming increasingly crucial for the federal government to deepen its relationship with the private sector so that we can supplement and reinforce the services that we provide in the public sector.
Thank you for inviting me to address you today at this important gathering of key stakeholders in the healthcare sector. At such a critical time, as we navigate a myriad of challenges in the sector, ranging from affordability to access and quality and so on. And I also acknowledge the comprehensive memorandum sent by the Healthcare Federation of Nigeria to the Presidential Fiscal Policy and Tax Reforms Committee on key issues requiring policy interventions, including, but not limited to, number one, the need for improved health insurance system, budgeting issues and healthcare affordability, the welfare of healthcare sector professionals, harmonization of healthcare sector taxation, waiver of duties, taxes, and levies on life-saving equipment, instruments, appliances, components, accessories, and software, ring-fencing sugar-sweetened beverage tax for the healthcare sector, creation of new harmonized system code, that's HS code, and tariff lines to reflect advancements in medical science, special corridor for expedited clearance of healthcare cargo, import and exports, among others. I'm pleased to inform you that your submission is receiving appropriate attention. We have also been engaging with the Ministry of Health in this regard to put all our efforts together so that we're not pulling in different directions. According to the World Health Organization, WHO, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. We believe that. I therefore wish to lend my voice and support on behalf of the Presidential Committee for the advocacy of the HFN for policy interventions including incentives and reforms in the health sector. Health, they say, is wealth. We must therefore do everything we can to achieve our objectives of affordable, quality, and accessible health care. Affordable health care is not just a luxury. It's not a luxury actually, but a fundamental human right. Unfortunately, millions of Nigerians lack access to basic healthcare services due to financial constraints. To address this, we must prioritize policies that make healthcare affordable for all, regardless of socioeconomic status. This includes measures to incentivize private sector investment in healthcare infrastructure. We aim to achieve healthcare security for our country while positioning ourselves to be a hub for Africa. Let it be that we are producing drugs from here and exporting to the rest of Africa for starters. So we want to attract also people coming from all over the world to seek medical care here in Nigeria. As policymakers, we have a responsibility to enact fiscal policies and holistic reforms that prioritize the health and well-being of our citizens. By working together, we can build a healthcare system that is accessible, that is affordable, and equitable for all Nigerians. I wish you a fruitful conference and look forward to receiving any additional policy recommendations and inputs you may wish to bring to the attention of the Presidential Committee for consideration. Thank you very much for inviting me today. May God bless the Healthcare Federation of Nigeria, and may God bless our dear country, the Federal Republic of Nigeria. I thank you for your kind attention.
Without much ado, I would like to invite to the podium to please take their seats in no particular order. Dr. Dapo Oduwole. He's the Director General, Public-Private Partnership, Ogun State. Please welcome Dr. Dapo Oduwole. Accordingly, please make welcome Dr. Kemi Ogunyemi, who is the Special Advisor Health to the Governor of Lagos State. You're very welcome, madam. Also make welcome Dr. Felix Ogedegbe, MD CEO, Cedar Crest Hospital. You're welcome, sir. And last but not the least, Madam Chinenye Okorocha, Partner Jackson Eti Edu. You're very welcome, madam. Thank you very much and welcome again to our carefully selected panelists for today. I'd like to start with Mr. Dapo. So we'd like to know, how do you assess the ongoing public-private partnerships currently in Nigeria? I mean, what do you see are the challenges, and where do you think that we can change the dynamics and have better and more quality access to healthcare in Nigeria? Over to you, sir.
Thank you very much. I think it's come to stay. We need each other. But how best do we do this? Public-private partnership actually strengthens healthcare delivery. It brings together health management experts, and you start to look at things like service delivery, project management experience, and of course the delivery experience in delivering projects on targets, on time, and according to specification in both the public and private sectors. And what do I mean by this? You can't have a meeting of delivering healthcare without having both sectors. And what I hope we would do is move to a situation where you don't have the public and the private sector only meeting at forums like this, when the HFN has a lovely program like this. We need to start to do this in the boardrooms, in project meetings. You need to start to look at it. When you have a meeting about healthcare delivery and all you have are private sector boards or public sector boards, then it's incomplete. You need to learn from each other. We're 64 years into this experiment called Nigeria. We should be much further ahead.
Thank you very much. A round of applause for him for those insights. Funds are highly required. We need to be pretty much more prepared, and we need to be deliberate about ensuring that we drive public-private partnerships. I would now like to go to Dr. Kemi Ogunyemi on policy. What would you say that government can do to activate an enabling environment that supports private sector investment in addressing the gaps in healthcare infrastructure and resources? Over to you, ma'am.
Thank you for having me. For someone who's worked in the private sector and not in the public sector, like the previous speaker said, we have to work together. There is no way any government can do this in the health sector without the private health sector. 60% of our patients go to the private sector. And we derive a lot from the private sector. Data, how to go about providing the accurate services that we need. This government, Minister of State Dr. Alausa has already spoken about what's happening in the federal government. But I can speak for Lagos State. We have a PPP unit, the department, because the governor, believes that we cannot do it alone. We believe that as well. So there are many things we've done, and we're still doing. So, for example, I'll just give a quick example. JBS was commissioned yesterday. JBS is a gerontology center. We do not have a care of the adult, care of the elderly center in Lagos. What JBC did through Dr. Ajala, sorry Dr. Ajala, I know you very well. But anyway, what she did was awareness that there's a gap in this area. And she was told yesterday by the commissioner that what we'll do is that we'll partner with you when we start thinking about how we also, as a government, for the public, because at the end of the day, private sector It's a business, you want to earn money. For the public sector, we want to ensure that our citizens get the best care they can get, affordable and accessible. All of us are seated here, we're seated on this panel, but it's all about the patient. It's not about us. It's providing the best care. Government cannot do it alone, and the best solution is to partner.
A round of applause for Dr. Kemi Oguyemi, and thank you for citing those examples. You're making deliberate efforts, you're targeting the private sector involvement, and you're driving partnerships. We hope to record more success stories, and we hope that more states can actually emulate what you're currently doing in Lagos State. My next question will be to Dr. Gafar, my favorite topic on universal health coverage. So I did challenge him before this discussion and said, it seems in this part of the world, the universal health coverage seems to be failing. The first question is, why is that? And what is Nigeria as a nation doing? What is the government doing more to ensure that universal health coverage is not a foregone conclusion in Nigeria? Over to you, sir.
Okay, thank you very much. I think on the subject of universal health coverage, let's first and foremost remind ourselves about leaving no one behind, ensuring that we have access to needed health care without suffering financial hardship. So, of course, the progress has been very slow in Nigeria, but nevertheless, we made some progress in the last few years. I think additional few millions of people have been put under several different financial protection schemes, the state health insurance scheme, and through the basic provision fund. But all these efforts, by any estimate, still less than 10% of Nigerians is covered by any form of financial protection mechanism. So the progress has been very slow. Why is the progress slow? So let me start from here. On the Universal Health Coverage Day last year, December 12th, Mr. President Bola Ahmed Tinubu said something. He said, health is back on the political front burner. What does that mean? That's very instructive. One, it means before now, health has not been on the political front burner.
Absolutely. There's a round of applause for Dr. Gafar Alawadi. I hear you talk about putting the right funding in place and spending that funding well. Innovative measures also needs to be accounted for in terms of making progress towards the universal health coverage. Thank you very much for your contributions once again. I'm going to call Dr. Felix Ogedegbe, and I'm going to have Ms. Chinyere Okorocha last but not the least, because she's the senior at the bar and very dear to me, so please pardon that deflection. Dr. Felix Ogedegbe, I'm going to ask you a question around health service provision. Given your experience, you do have experiences around the chain of hospitals. In what way can you say that private sector can participate further to enhance the quality of healthcare services, especially at community level in a country like Nigeria? Over to you, sir.
Yes, thank you very much. I'm glad at the point at which I've been asked to speak, and I've heard a lot of what has been said, all trying to face and respond to the same question in different ways. The private sector which I represent involved in providing care at multiple levels. We heard from the Honorable Commissioner of Health this morning, the figure of 28 million people, for instance, in Lagos. We've heard a few other things. He said there are 300 public health facilities, and then times 10 of that, 3,000 are private. So it does seem that we all agree that the private sector has the majority of institutions and are providing the majority of care. But I think we must draw ourselves to the real issues here. If we're working with 28 million people, that is 28 million people for whom government has responsibility to provide care. The question therefore is, how do you do that? That's where the private sector comes in. I mean, those of us who are well versed in healthcare planning know that the government could decide to do it all by itself. But the government could also decide that they want the private sector to play a role. It does seem from all the information that's been placed before this morning that we all agree that this is a requirement. So healthcare is a right. It's not something for some people in this room and then for millions of people outside who can get. And we also agree that it seems that private sector participation, it's an excellent way of providing healthcare. Because of what we already know are the characteristics of private sector-led enhancement of care. Private sector has a discipline, private sector is profit-driven. But if you look at what we have right now, I dare say that in Nigeria, most of the private sector healthcare involvement is from doctors and medical people. The private sector healthcare space right now is not very attractive for investments. And that has to change. Government would say, for instance, that we are ready to implement changes that allow people and encourage people to bring in money, investments into the private healthcare space, and then provide the regulatory framework to make that work. And I think that is what the government is about. And on the other side, on the receiver side, we must see that people are actually being treated. As we speak, people are not being treated. What I see in practice is horrible and terrible. Being that we work within, the big cities of Lagos and Abuja, I wonder sometimes when I see what people have done in those big cities, and I wonder what's happening in the hinterland. So they've been to native healers, they've cut some stripes on their body, they've done all sorts of things. The health-seeking behavior is apparently so poor because they can't just afford. And we are always inundated with treating people who can pay all the time. So can the government put down the regulatory framework and the government find some way of ensuring that people can pay, creating, not just, for instance, infant mortality for those who've died, there's also infant morbidity. So there are a lot of people who are being born with inadequate brains, damaged brains. Maybe that contributes to the insecurity as well. Maybe we have people who really can't understand the consequences of their actions. And that's our fault as a people.
Absolutely. And Dr. Felix, I left you to speak because, I can hear the passion and the truthfulness of the realities that we're faced with. Talking about the non-privileged as we are, there's a certain divide. And if we don't crack it or talk about it in a room like this, healthcare is to be accessible to every living Nigerian. And I'm happy that you talked about those challenges, and I'm sure the audience have heard you. The critical stakeholders have taken down the notes, talking about the regulatory framework, talking about the enabling environment. It's not yet where it should be. Talking about scaling private sector involvement, it's not yet where it should be. And so thank you very much for those insights and contributions. Please a round of applause for him once again. I'd said that I will go to Madam Chinyere lastly, because she brings to bear and to our insight the legal perspectives, which you will know is really quite a fundament to all of these conversations. In legal parlance, Madam Okorocha, what would you say is to be prioritized in the scheme of things right now, especially regarding the challenges and our desire right now to ensure that private sector involvement is optimized and is scaled in Nigeria?
Thank you very much. Good afternoon, everybody. So from my perspective, where I sit, I've often wondered why every year we kind of talk about the fact that the budgetary allocation to healthcare is below 5%. And it's been like that for years. And I often wonder why that is the case. And at some point I've looked at the statistics with other countries, even in Africa, and it just boggled the imagination that, isn't that a way to fix it? So if we say, like Dr. Ogedengbe said, that we all agree that private stakeholders have to lend a hand because the government can't cater for everything, then there has to be an enabling environment, isn't it? How do you ensure that the private sector stakeholders who you are asking to help you, and this is to the government now, we're asking them to help you, because Nigeria is over 200 million people and the government doesn't have the capacity to cater to everybody. How do you ensure that the environment is structured in a way that is made attractive for the private sector to engage and to actually engage in a way that is profitable? Because another thing I've always I've noticed, and it's also very similar in health in the legal services, is that doctors often struggle with the fact of being a doctor and then being a manager, so to speak. You know, so a lot of the time you find eventually the medical practitioner would leave medicine and enter into the administrative part of the business. And that's because it does require you to have some sort of a business training in order to run a profitable business. But the truth of the matter is, to have a profitable business in Nigeria is very difficult. How do you ensure that the regulatory environment is conducive, that the government has policies in place to protect you as an investor? Why should you invest in a business where you know that the exchange rate can jump overnight by 500%, which has a direct impact on what it is, the product that you are selling, has a direct impact on your ability to provide the services you're providing. And ultimately, it's the end user that suffers because those costs have to be passed on to others. Why do we really think that there's this Japa syndrome? Why are doctors leaving us in the hundreds, over 5,000 just in the last, I don't know if this is the last year or so? Why is that? Our environment is not an enabling one.
Absolutely, thank you so very much. And I must really appreciate the organizers for this carefully selected balance of panelists. We've heard from a lot of very useful perspectives, and we hope that we're a step towards actualizing some of the plans already in place. I did hear Dr. Gafar say that this current administration has said that healthcare will now be in the front burner. We will hold you to your words. Thank you very much. It's been a pleasure moderating this session. Please a round of applause for the distinguished panelists. I feel very honored to have moderated. Again, my name is Maurice Atoki. I'm the Chief Executive Officer of African Business Coalition for Health. Thank you.
Once the federal government starts to spend more in the areas of infrastructure, equipment, and delivery of care to the citizens of Nigeria, pulling the private sector along, we'll be able to create more jobs, opportunity for a teeming young population in Nigeria. We'll be able to create more entrepreneurs that will go into the health sector. And as we continue to do that, that would involve people, entrepreneurs going into the rural community as well, because healthcare is, together with education, are the two biggest social part of any country. And what do you need? You need the people. If you want to provide decent, affordable, sustainable, and durable health care, you provide it to people. So you have to go to where the people are. And that's how it's going to get to the rural sector as well. And I need to reemphasize again, President Bola Ahmed Tinubu's commitment to Nigerians. He has said repeatedly that every single citizen of Nigeria is entitled to meaningful and comprehensive health care. And that's what is mandated us to do as ministers at the Federal Ministry of Health. And that's what we're doing. We're working for him and we're working for Nigeria through his mandate. So the private sector, our involvement with them, it's a new environment. Private sector will thrive. We have a government that will ensure that private sector thrive in Nigeria from now on.
There are several challenges, which is why we are actually having this conference talking about bridging the gap. Because in healthcare, there's so many things that need to be put in place to ensure that the Nigerian healthcare system is developed. We've heard from the minister. Our topic, bridging the gaps in healthcare, using public-private integration for sustainable growth, is critical because We can't have public on the one hand and private on the other hand. We need them both to work together seamlessly, and that's what this conference aims to do. We're strategizing, we're creating solutions here, and that's great for the Nigerian people.